and healthcare forums about what we should do, how we could get out of this mess, what we should be talking about. Why don't we do what Indiana's done? Create a catastrophic health pool net. We do it in Indiana. Why don't we create a net for the people that are without instead of dragging 90% of the country that have and pulling them down to not having? Why are we doing that? Why would we not put tort reform at the top? We have it in Indiana. We have medical malpractice caps in this state. And Jim will tell you, we're the envy of most states around the nation because we don't have a shortage of doctors or researchers or cancer specialists or research facilities or Riley's Children's Hospital and cancer clinics. And we have that because we cap medical malpractice. We have trial lawyers in a box in this state. We wouldn't even talk about at the federal level. The portability, the accountability, the transparency of pricing, all those things could have been done to allow the free market to drive prices down using competition. They didn't talk about it. It wasn't even about that. It's about what we have now, which is your government now that has its hands for the first time in this country in the auto industry, the banking industry, Wall Street, student loans, and now every individual life of every American beholden to a bureaucrat someplace to decide what's going to happen. And I'm telling you, I lived in this stuff for 4.5 years. Over there, they called it quasi-socialism. Every country in the European Union, it's described as some kind of a socialistic environment. And I don't think ill of these people involved that are elected because I still honor the office that they're in and the majority of Americans voted them in. I get that. But this is where we come in. This is where countries rise and fall. This is where cultures rise and fall. This is where believers rise and fall as to what do you really believe in the gut and the heart of who you are.